Okay, so good afternoon and welcome. I am Andrew Jawa Thomas. I work at Robert Wood Johnson University Hospital. I'm one of the assistant directors there, and I run the district program for the hospital, which is just transitional care for low-income patients. We as Sierra Leoneans usually come together for every single event from, wedding showers to wedding to baby showers to every event until 10, 50 years anniversary after death. So usually when we have an event like Ebola, we are almost obliged to come together to share information, to create awareness. So that's the essence of this event. Me and Dr. Suare, who I'll introduce later, work at the same hospital. And we've been discussing this for a while to see how we can actually get everybody together to really discuss what the hospital is planning, what CDC is saying, and what the concerns are from our people. What is the stigma? How do we deal with that? So there are certain things that we probably will not be able to answer, but there will be questions about that, like what is the fundraising activity? We're not doing that today. We're going to try to answer questions about, what are the symptoms of Ebola? What do you do if you have a family member coming from Sierra Leone visiting? What do we do? Things like that. So, but before we start that, as usual, we start all our events by prayers. So I'll definitely ask Reverend Cabs if he can just lead us in a short, very short Christian prayer, and then I'll ask Suleiman Kagbo to lead us in just the Al-Fatiha. Can everybody hear us? Can everybody hear me all the way in the back? Fine? Great. Okay.
Let's bow our heads. Father, in the name of Jesus, we thank you for bringing us together for this Ebola awareness program. Father, you know what is going on back at home. We commit our people into your hands. We pray for your mighty touch to our nation. We pray that you will help us to get rid of Ebola as soon as possible. We pray that the same thing would happen in Liberia and Guinea, where the Ebola is also raging. Father, we commit our meeting into your hands. We pray that we'll have fruitful discussions. We pray that we'll be able to discuss things here that we'll be able to pass on that will be beneficial to those who need them. Father, we just thank you and we just bless you in Jesus' mighty name. Amen.
Amen. Amen. Thank you, Reverend, and Mr. Suleiman. If you can just lead us in the Al-Fatiha.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين. Thank you.
Thank you. Thank you so much. And we will have a very brief introductory remark by the chairman of SLCNJ, which is an umbrella organization for probably almost all the Sierra Leonean organizations in New Jersey, Mr. Lamin Al-Razi.
Thank you very much, Mr. Jawa. If I may ask the people in the back to please come forward to the left side over here, I think that will be better. I want to welcome everybody here today to the Ebola meeting generated by Dr. Mafudia, Suare, and Mr. Andrew Thomas. They came to us about a month ago with the intention to have this meeting done. Unfortunately, we had planned to hold this meeting about 2 weeks ago. but because of circumstances beyond our control, we were not able to do it. So we are here today. I want to recognize the presence of the State Department of Health. I don't know if Middlesex County Health Department is here, but as you all heard from Mr. Jawa before, it's going to be a presentation about the awareness of Ebola in our country and how should we handle it here in case, we're having someone coming from abroad to stay with us, some of the things that we may need to do to protect all of us. And at this point, I'm going to call upon Mr. Andrew again to please take it from here. Thank you.
Thank you so much, Mr. Al-Razim. He has been very, very helpful in actually getting this to fruition. It's actually very difficult, as we all know, to bring Sierra Leoneans together, but SLCNJ has been doing a fantastic job at doing just that. This is going to be a very brief presentation by Dr. Suare before I even introduce the panel. Mostly it's going to be a question and answer sessions. We all have questions about what to do, what not to do, what to say, how to react when somebody says something negative to us. Those are just questions that we can share. Certainly we will not have all the answers here, but at least if we share it as a group, we can start thinking about questions like that and see what we can do when, we as a community are being stigmatized for, something that's happening to us. So if we can come as a group and start discussing that, I think that's just the right thing to do. For the panel today, we have Dr. Suare. He's an instructor from Rutgers University, and she has been really, really committed. You have no idea how committed she was. We've been debating who will be the first person to go to Sierra Leone, and it's just really, really good to see that kind of commitment. And she'll be telling us about the medical aspect, what is Ebola, and how is this affecting us. And she is very familiar with the medical system in Sierra Leone, so she's familiar with most of the doctors. This has really been personal to her because she knows all the doctors that have passed, and me and her, have been in constant communication with the medical community in Sierra Leone. So she knows a lot about what's going on there. Did not practice there, but she actually did part of her residency in Sierra Leone, so she's very familiar with that, which is really good. So she will give a brief presentation. Of course, we have Mr. Pavi Jallo, one of our community leaders, somebody I have, developed a great admiration for. I like the way he thinks. He's very focused. He's very understanding. And I've been really, really impressed by, his thought process and his school of thought in particular. So Mr. Pavi Jallo is here. In case there is questions that we have about, community affairs, we have religious question. He cannot probably answer the religious question, but he will know who to direct the question to in the community. So I am almost certain that he will skip the religious question. He's very, very diplomatic in that sense. But he might be able to direct us on what to do. And of course, we have John, who's the representative from the Middlesex County Office of Health Services. He's a health educator and a risk communicator. And we're very, very grateful to have him here today. It's a Saturday to really get somebody from the county or from the state to join us. It's really, really commendable. Thank you so very much. We actually reach out to the state and we send them some questions, just some general questions that we have, and they sent us answers for that. It was very difficult to get somebody from the state. I'll put my wife on the spot, and she works for the Department of Health. So if we have questions about this, for the state, she might not answer, but we'll refer her to take it to our colleagues and the people that she works with. Thank you so much for doing that for us. And I know I'll pay for that, so it's okay, I'll pay for that. I'm ready to pay for that. But everything here has come together for the help of one particular person, Ms. Miriam said. Can you please just stand up? We really have to thank you, because it is very difficult to organize something like this, especially in the hospices of an institution like Robert Wood Johnson University Hospital. And there are certain points where, we just say, what, forget it, I give up. She has been pushing and pushing and pushing. Let's just do this. She's the director of community health programs at the hospital. She rented this hall. She provided the food. She came here herself, and I am really, really, really grateful. Thank you so very much. Gracias, gracias, gracias. Thank you. It's very, very commendable for that. So I will hand the floor over to Dr. Soare. And please, please, please remember, it's a question, it's a discussion session. It's a question and answer. Any question is fair game, but the fairness is also for you guys to understand that we don't have the capacity of being able to answer all the questions. So you can ask any question, doesn't mean that we'll be able to answer all the questions. And another thing I'll say is, if you feel comfortable asking your question in Madingo, in Fula, in Kono, in Creole, anything, feel free to do so. We'll have one person who can interpret it in English, okay? Some people feel comfortable asking their questions in Creole. That's fine. We can, change the question to English at any point. So feel free, feel comfortable. Please, please do not hesitate to ask questions and contribute to your discussions. Please. Thank you, and Dr. Soare.
Good afternoon, everyone. Thank you so much for coming. We put a lot of thought and a lot of effort into this, but it would be meaningless if no one came to listen, and most importantly, to participate. We don't just want you to come listen to us talk. All of you have been to some kind of Ebola meeting or call conference or something at some point, so I know a lot of people know a lot of things about Ebola. Not all of them may be totally accurate. So the goal of my presentation is not to tell you everything about Ebola, but just to kind of hit the key points, and hopefully make sure that I have it as clear as possible, just in case there are some misconceptions. And any part of Ebola that I didn't talk about that you want to know about during the question and answer session, we'll be very happy to try to answer them for you. So there's some things I deliberately did not put on there because I really want to know if people are thinking about it or or they're interested in it. Okay? And there's no stupid question, there's no foolish question, there's no ridiculous question. It doesn't have to be your question. It can be something somebody else asked you before and you just thought about it. Maybe you had the answer and you wanted a different way to have that information to pass on to the person. Please feel free to ask those questions also, okay? Okay, so basic number one, what is Ebola? Ebola is not a person, Ebola is not a country, Ebola is not Sierra Leone, it's not Liberia, it's not Guinea. Ebola is caused by a virus. It is not witchcraft, okay? So that picture up there, that's a picture of the virus, what it looks like under the microscope. It looks like a thread when they look at it under the microscope. You cannot see it with your naked eye. What you can see is what happens to someone who's been infected by the virus. It's a virus that we've known about in the scientific world for years. At least 1976 was the first outbreak of Ebola in the DRC, Democratic Republic of Congo. There's now formerly Zaire, and in the Sudan, 2 places. So it's been around for a while. It did not just appear in Sierra Leone, Liberia, and Guinea in 2014. Okay, it's not a new disease. The virus normally lives in wild animals. We think best guess that in bats, all animals have some kind of virus that they carry. Humans we have our own bacteria that we carry that they don't make us sick, but if that bacteria goes into another animal, it will make them sick. So same thing, animals have a lot of bacteria and viruses that they have that just live with them. It's part of their ecosystem, but if it goes from the animal to a person, it can make them sick. Ebola, we think, lives normally in bats, but it doesn't make the bat sick. What happens is somehow it goes from the bat to another animal, like a monkey, chimpanzee, some other animal, and it will make them sick. And it's easier from another animal like that to a human being because of our interaction with animals, either for food or for hunting or things like that. And it transfers to a human being, and it causes an illness. In human beings, it really causes a havoc. It causes outbreaks, because we're social beings. One person gets sick, they get in contact with another person, they get sick. So that's what we're having right now. It's a huge outbreak, the largest outbreak ever of Ebola. And there have been about 9 outbreaks before that. So what are the symptoms of Ebola? These are the most common symptoms. Fever, one of the earliest symptoms. So everyone has heard about them with the fever checks and things like that. Fever is one of the early symptoms. And the fever can be pretty high. Muscle pains, body aches, headache, feeling very, very weak and tired, the stomach pain, vomiting, diarrhea. Sometimes there's a rash, not always. If there's a rash, sometimes it comes in early, it comes and it goes away, and most people may not even know they have one. And the bleeding. Bleeding can happen, and it usually happens later on, not in the very beginning, so it's usually not the first thing that person had. They don't just start bleeding suddenly. It usually happens after they've had some of these other symptoms, and then they have the bleeding. Those are, the most common symptoms. So you notice I didn't say runny nose, cough. Sore throat sometimes happens, not very common, okay? Sometimes people have a red eye, but they don't really have like itchy eye and, pink eye and stuff like that. So when do you start showing symptoms? So usually people start showing symptoms about 2 days plus after they've been infected. So yes?
You want us to save a question for the end or interrupt you?
If you have a burning question that has to do with what I'm saying, go ahead.
Can you go to the microphone? No, I don't have a question. I just want to clarify.
Yeah, good point.
And if you have a question, since, Amjet may want to record that, you can just raise your hand, or I can take a microphone and go over to you. Then we can get it.
Good. So usually anywhere after 2 days after someone's been infected. So the virus is in somebody else. You get in contact with that person, and I'll tell you how it can go from that person to you. The virus gets into you. It takes about 2 days before you start having symptoms. And it can take up to 21 days. Most people show symptoms between 8 and 10 days. I don't know of any specific case where someone did not have symptoms until 21 days. At least not in this outbreak so far. I haven't heard about that. Okay, so usually between 8 and 10 days average, but it can be as early as 2 days, as late as 21 days for someone to start having symptoms. So how does the virus spread? So from the animals to people, you have to, or from person to person, you have to come in contact with someone's body fluids. When the virus is in the system, let's say we take it from the bat. Let's assume the bat has Ebola. The bats eat some fruits. They have their spit in it. We all know about, bat moths, right? With the mangoes and things like that back at home. It's on the ground. The bat ate half of it, and the other half is there, and it's all wet and gooey, and someone takes that and they eat it. The virus is in that saliva, and now the virus is in you when you eat it. Or if someone is infected, or someone, let's say an animal, let's say a monkey or chimpanzee, any animal has Ebola, and you kill that animal, you hunt it down, you kill it, and you're preparing it, that blood from the animal gets on you, then you can get the virus through there. Usually, if you have like a scratch on your skin, or, you wipe your eye, or you don't cook the meat properly, then the virus gets into the person. Now, from person to person, that's when we really know that Ebola is around. So a person has Ebola, they start having fever, they start having vomiting, they start having diarrhea, they're sweating because they have this fever. You take care of them. Their sweat gets on you, their stool gets on you, their urine gets on you. You rub your eye, you wipe your mouth, you don't wash your hands properly, you touch food, and then you don't, something that's raw and it's not cooked. Now the virus gets in you, or the person dies, and we'll talk a little bit more about that. So the virus, can go from person to person, and it's through the body fluids. It's not through the air. It's not by breathing the same air as the person. It's by coming in contact with their fluids. And those fluids are blood, vomit, stool, sweat, tears, saliva, semen in men, all those fluids. And pregnant women, the pregnancy fluid, that, that water, if their water breaks, that also can be infected. Okay? And also, if someone, gets injected, with a needle that it's not new, that was used on somebody with Ebola, that is another way to spread the virus. Okay, so Ebola is not spread through the air. It's not like the flu. You can get the flu by being in the same room as someone with the flu. But you can't get Ebola that way. And we know that because they, over all the almost 40 years of Ebola outbreaks, no one has caught the flu. No one has caught Ebola who did not have contact with body fluids or, blood of somebody who's infected. And they've looked at people who are in the same house. One person got Ebola, they didn't touch the other person, and that, the person who stayed separate did not get sick. It's not spread through regular food. So your regular food, even if you got your cassava leaves from back home, you can't get Ebola from your cassava leaf. You can't get it from your potato leaves. You can't get it from your fish or your chicken. You cannot get Ebola through regular food and regular water that we drink, okay? It is not spread by mosquitoes. A lot of people worry when we talk about blood. It's like, oh, the mosquito bites the Ebola person and then it comes and bites me. No, so it doesn't spread like malaria. You cannot, no mosquito has been found to have Ebola or to transfer Ebola or any other insects for that matter, okay? And Ebola is not spread by people who do not have symptoms of Ebola. You have to have the symptoms. So even though I told you can get infected and maybe a couple of days before you start showing symptoms, in that couple of days before you start showing symptoms, you cannot spread Ebola. And the reason is, even though the virus is in you, it's still trying to multiply and get to the places where it can escape from that person. And until they start producing those body fluids that have the virus, they don't really spread it to you. So that's why, someone who was not showing symptoms yet is not considered contagious. I think there's a question. Oh, 1 second. This gentleman had a question, and then I'll take your question if you have one. I guess everyone has to come up. Sure.
So I just want to go back to the saliva and the body fluid question.
Yeah.
Is there a time limit as to when Ebola is still active? Is there, say, for instance, if an animal so-called eat an apple in March, and then I happen to eat the apple in December. In December, okay. Is there a lifespan where that virus become still active or is dead during the process? Because I know you said we can't get it through food, but what happens if somebody that preparing a cassava leaf happen to have Ebola and they happen to spit in it, and then they travel 2 months to the U.S.? Is there a possibility I may be able to contaminate, eventually contract the diseases or not? I just want to...
Okay. That's a really good question. So we know that the virus is easily destroyed by heat, and it stays on wet liquid surfaces. If it's suspended in a liquid. So if someone spits, for as long as before the spit dries or stuff like that, the virus is still, for a few hours, it will still be active. But then it gets killed by heat very easily, which is why if you see those pictures on the internet of the treatment units and they have those gloves and the thing hanging, they put them on sticks and they're drying, that's part of the reason. Here they will put them in an autoclave and kind of heat it to kill the virus. So that's why regular food, that's why even with the meats and stuff, it's that period of time before you cook it, that's when you are really at risk. So, and for all the body fluids, whether it's saliva, tears, there's a time period that they've been, in the person, that they've been able to isolate the virus. What I can tell you is that in semen, the virus lasts the longest. So it lasts up about at least 40-something days. They've been able to test and find the virus still in the semen of a man who was infected with it. And one of the things when someone gets treated and they recover from Ebola, for the men, they're supposed to either abstain from sex or use condoms for 3 months as a safety precaution, because you can spread, Ebola through sex up to that period of time because the virus is still there. In the tears, they found it for a long period of time after someone recovers, but not enough that they don't think you can, if someone recovers from Ebola and tomorrow, 2 weeks later they cry on you, are you going to get Ebola? They haven't found that happen. And on another thing, I have a slide, it's a little bit more medical for every body fluid, how long after someone recovers that they've been able to find the virus. For most, the virus clears. That's why they test them before they discharge you. So someone who, gets sick with Ebola and, makes some cassava leaf, and then 6 months later, I highly doubt, that you're going to find Ebola in that cassava leaf, 6 months later, especially once you cook it. Now, you have to, keep it in water, I think, even with that, I don't know how long it will survive, but highly unlikely.
It doesn't live outside the body.
once it's, for a long
Yeah.
time, once it has dry.
Once it's dry, exactly.
So on a hard surface, it could be, like the body fluid on a hard surface could be several hours or something, if the body fluid is still wet, it could be,
Yeah.
Several days.
Yeah.
Yes. Yeah, I received newspapers from Sierra Leone.
Mm-hmm.
Reverend?
Oh, yeah.
For him.
Okay. I received newspapers as a journalist. I received newspapers from Sierra Leone. So, am I at risk?
No.
No, you're not.
No, you're not. Your newspaper is not going to carry it.
You want to just finish the slides?
Yeah.
Let's just finish the slides
Yeah.
because some of them will be addressed
Yeah.
on the slides, and then we can take questions.
Okay.
Okay. We're actually thinking since
Yeah, so- Let's kind of change plans a little bit. Hold on to your question. If you can write it down, put it on your phone notes. Let's go through the slides quick, and then we can really spend time and go through those questions, okay? Okay.
You good on that one?
Next one. Okay. So when can a person spread Ebola? Only after they have symptoms, and the sicker the person is, the more virus they have in them, and the more easily, if you're exposed to their body fluids, the more easily you can get it. And if you think about that, as a person gets sicker and sicker and sicker, they have more and more and more virus. By the time they die, they have about the most amount of virus in their system that they were ever going to get. And the person who dies from Ebola is the most infectious, okay? They have the most virus in them, and that's why this whole big deal, on the news talking about burial and not washing bodies, and we'll probably talk about that a little bit more, but that's the reason for that. It's that person, by the time they die, they have so much virus. And if you think about it, the virus is kind of like, they're smart. The virus, they're not like, dumb little thread thing just sitting around. It gets in a person and it's like, I don't know if I can live in here. Well, I'm going to use up their, machinery and, and multiply a lot of me so that, we can survive. And then, it looks like this guy is dying. It looks like I killed him. Well, I need to keep surviving, so I need to jump into somebody else quickly. And as many of my kids as I can get with me will get away. So when that person is dead, those viruses are trying to find another living person to, or animal to get into. You don't want to be the person, that they're going to hop a ride on, okay? So who is at highest risk for getting Ebola? And we'll talk about all, the other things that people are worried about. But the people who are the highest risk are those who actually take care of someone who has Ebola or who are in close contact with a person who has Ebola. And so that's your healthcare workers, your doctors, your nurses, the lab techs, the burial, all those people who are going to be in close contact with an Ebola patient. And also people in a house, if you are the mother and your husband is sick and you want to take care of your husband because that's what you always do and you're going to clean him up and do that, you're going to be at very high risk for catching Ebola. Okay? The people who wash or bury Ebola victims, because at that point when they died, there's a lot of Ebola virus in them. If they're not wearing the right protection, same thing with the healthcare workers or anyone who's touching. If they're not wearing the right protection, they're going to be high risk for getting Ebola. So is there a cure for Ebola? Right now, there's no proven cure yet. There are treatments, there are medications, there are vaccines that they've tested in the lab, and they look good in the lab, and now they're doing testing on healthy people to see, make sure that it doesn't really make healthy people really sick. And very soon they're going to be using them on people who actually have Ebola to see if they'll be cured. They've already used, everyone heard about ZMapp. They already used ZMapp on a few people, and a good number of those people got better. We don't know whether it was the ZMapp or not. But not necessarily ZMapp, but there are other medications that are being tested. So even though there's no cure right now, there's no medicine that we can give someone with Ebola, there's no pill you can give them right now that will take Ebola away, out of their system, there are treatments, okay? And what is that treatment? The treatment, we'll call it supportive care. So someone with Ebola has a fever, they have a headache, their body hurts, so give them pain medicine, they give them something for the fever so that they will be comfortable. If they have diarrhea and they're vomiting, they're going to get dehydrated. We all know about cholera and how people get dehydrated. Same thing with Ebola, even much worse. Would they give them either ORS if they're able to drink? They give them fluids through their IV to keep them hydrated. And if they have malaria, also they will treat them for malaria. If they have another infection, at the same time, they will treat them for that. If they have diabetes, they'll try to treat their diabetes. If, in Africa, it's a little bit challenging depending on where you are, but definitely in the United States, whatever other medical problem you have, they will treat that, while they're supporting you through the Ebola. So this is the reason we want people to go get treatment and not just try to do this at home, because it's about taking care of the other issues and helping you stay alive long enough for your body to get rid of the Ebola virus and for it to get out of your system, so you have a chance to make it. The sooner a person, who's sick with Ebola, the sooner they start getting treatment, the better their chances are of making it. We all know that it's not every single person that got Ebola died. There are people in little villages who got Ebola, they got better. In this country, only 2 people in America have died from it, and those both people are the ones that came and they were already sick by the time they started treatment. And we've seen that all those people who got treatment, who started getting treatment like very soon in the first few days after they started getting treatment, most of those people survive. So it is very important. The sooner you start treatment, the better your chances. It's not a guarantee, but your chances get really much better. And the better the treatment, the better your chances too. Okay, so can we prevent Ebola? Absolutely we can, okay? So Ebola is not this thing that we have to give up and put our hands up and they're like, oh, well, everyone's gonna die, you're not gonna die or not. No, we can do something about it. You and I can do something about it. People back at home can do something about it to help prevent. Basic things, wash your hands, wash your hands, wash your hands. If you get any virus on you, the sooner you wash your hands and dry them, the sooner it's gonna get out of your skin and not enter into your body. Avoid contact with body fluids of anyone who has symptoms of Ebola. If you're a healthcare person and you have to take care of someone with Ebola, you have to wear the right PPE, the right protective equipment. So that's the gowns, the mask, all that stuff, okay? Don't touch, when someone dies from Ebola, someone dies and you don't know why they died, don't touch the body. Back at home, they're telling everyone, there's a number they can call, let the burial team who will be dressed like that come and get the body. You don't do it because you'll be putting yourself at risk. So, what to do if you suspect Ebola infection? And this, this applies both to us and to the people back at home, okay? Because, we may have family that's coming. We're going to talk about that. We may have people that come from back at home and, they get sick and we're like, oh, well, I don't know. They just came from, from Freetown and now they're having a fever. Should I worry? If someone in your house may have been exposed or you know for sure they've been exposed to Ebola and they're having symptoms, don't put them in your car and take them to the emergency room, okay? Do not do that. The emergency room does not want that. The hospitals do not want that because we don't want to take people by surprise and you don't want to expose yourself. Call 911. You can call, if you think like, oh no, I think maybe they just have the flu, but I'm not sure. I don't quite remember. How do I tell the difference between the flu and Ebola? Call the doctor or call 911. If they have a doctor, call the doctor. And then let them guide you. If they will do screening questions and make sure you tell them that the person was exposed. Or, if you don't know if the person was exposed, but they just came, back from a region that has a lot of Ebola, let them know that information, because that's going to be very important to make that decision. And that way, they can prepare. If that person needs to come to the hospital, say someone who's been exposed or has a potential exposure to Ebola, EMS will come, they will be dressed appropriately, and then they will take that person to the hospital. We don't want to take them by surprise. We don't want to infect other people just in case that person does have Ebola. In the meantime, while you're waiting for the person to, get the appropriate care, you're going to separate yourself, isolate them in one part of the house. If it's in a room, just let them stay in that room. And, the rest of, the members of the household stay someplace separate, whether in the living room, another room, whatever, until they get the person out of the house. Don't touch their body fluids with your hands. There'll be people who will come if there's a mess that, they will come and decontaminate and clean properly. And make sure you're washing your hands frequently with soap and water. You can use alcohol sanitizers also. So, and I'll just do a brief, I think we'll probably hopefully talk about this more in the Q&A. What to expect if you go to the hospital. And this is whether or not you have, Ebola. I don't know how many of you have been to the hospital since the whole Ebola thing in America. But right now, if you go to any hospital, any clinic, you're going to be asked, number one, have you traveled recently to West Africa? Or have you traveled? They might just ask you, have you traveled to Africa in the past 21 days? And then if you say yes, have you traveled to the specific countries that have Ebola in the past 21 days? And if you say yes to that, do you have any, fever? Do you have any of the symptoms? And then they will decide what to do at that point. Do not get offended. They're not asking you that just because you have an accent. They're not asking just because you're black or you have a foreign name. They're asking, and they should be asking every single person, black or white, foreign or not, because there are a lot of people who are going back and forth. In my clinic I practice, there's a big sign on the door that says, if you've been to West Africa during the past 21 days and you have the symptoms, go to the hospital, call 911. But basically they're doing that, and every place is, has a system in place to triage that, okay? And if there's a concern that you have been exposed to Ebola or you may have Ebola symptoms, and you go to the hospital, people are going to be dressed in hazmat suits. Everyone who's going to be interacting with you is going to be dressed like that. Don't get scared. They're just trying to protect themselves and everybody else, so we don't start an outbreak in the U.S. Okay. I think these handouts are out there if you did not get one. The state has some great handouts. The CDC has great handouts. And this is specifically for people, for people like us who may have family coming from back home and will be staying with us. And it gives information on what is going to happen with them. They're going to be asked to monitor their temperatures. That's assuming when they come in, they don't have a fever or anything else. They're going to be asked to monitor their temperature. They'll be informed on what the symptoms are, and they will, let you know that you need to call 911 or the health department if the person has any symptoms while they're being monitored. So those handouts are out there for you. And this one, I think it's important. I'm a primary care doctor, and I believe in the flu shot. So one great question that a lot of people have, this is flu season, so what if I have, cough and, I have a headache or fever, how do I know is this the flu or Ebola? And they have a great, thing that says flu symptoms, Ebola symptoms. The major difference really, besides exposure, right? If you haven't been back home and you haven't been around anyone that could have had Ebola, you don't really need to worry about any of that, even if you have, fever, tiredness, diarrhea, because you can just have, regular GI bug or, regular stuff. But so that's for people who worry, even though they don't have any risk. But if there's any chance that you have risk, one of the main things that you see there is the coughing, the sneezing, runny nose, all that stuff that you get with the flu. You don't get that with Ebola. And the flu symptoms, they all kind of happen like, just like that. And then the Ebola symptoms kind of go through a sequence. And there's a handout for that also, I believe. So you can look at that and you can share that with people. Obviously, we're now, doing screening in the U.S. as of the past month and a half for Ebola. So anyone coming into the U.S. Will be screened based on where they came from. If you came from Africa, you're going to go to one place, and then they're going to ask you questions about where you've been, who you've been exposed to, whether or not you were exposed to Ebola while you're there. I already mentioned that the health facilities are all screening. And depending on what your screening turns out to be, if someone has symptoms, they'll be quarantined. If someone has symptoms of Ebola, then they will go to the hospital. If not, they're doing active monitoring for those people, and it's for 21 days. So one thing that I want us to do today before we leave is to spread this message, okay? Some of the things that we can do as a community really is to help our people back home. We know what the challenges are back there. Even though most people now do accept Ebola as a disease and as a threat to their health, there's still that issue of going from acceptance to actually acting to prevent yourself and to deal with the issue. So we're still having a lot of, transmission in Sierra Leone, while, other areas it's getting better. It's going wild in parts of Sierra Leone. We have a responsibility for our people. We're helping them, their sisters, their brothers, we're supporting a lot of our family members. They will listen to us. They do listen to us. Because if you're going to send money for them, and every time I send money for people, whatever I tell them to do, they'll do it. So they'll listen to you. If you have to send them, $50 first, do it, whatever it takes. But let's give them good information. Let's text them. I get WhatsApp messages from people all the time. It's an easy way. Before we leave here today, I'm going to ask us to do this before the conclusion and just, send people messages, some basic Ebola messages, and say, hey, I'm thinking about you. I care about you. I want you to be safe. Let me tell you a few things that you need to take seriously about Ebola. And that's the number in Sierra Leone, the 117, that people can call, if someone has symptoms or, someone dies. There are issues with that, whole call thing because there's not enough people to manage, but it's still the best way to do things. And there's a YouTube video also that you can share with people back home. And this is the information. The state came up with this information, and they have this phone campaign also going on that they're encouraging all of us to do, to either text or call family members with this information. I know we don't play with monkeys or bats, but.
And that's out there too, Marion brought that as well.
What, that the,
This one,
yeah. Okay. Stigma. One of the things that made me really want to do this, besides just spreading the Ebola information, is I started getting reports. I've been traveling back and forth between here and the DMV area, and I've been getting, stories and reports of people who are losing their home care jobs, people who are having issues at their work because, they're being stigmatized. For people like, oh, you're from Sierra Leone, that's a country with Ebola. I don't want you in my house. You might spread it. That's a big problem. As a community, we cannot just deal with it as individual people. A lot of people might not say that they lost their job or they lost the case because of this. They might think, oh, well, I lost one case, I got another one. But if a lot of people get affected, by this, it becomes a serious problem. A lot of us have family back at home that depend on us and depend on our incomes also. So it's a big problem for, for us to, for this to be affecting us. And it shouldn't, irrespective of all of that. We're all equal citizens here, and every human being should learn to respect one another, and we need to learn to know the fact, and we need to learn not to stigmatize each other. People joke about Ebola, and it really is not it's not a joke. So we need to know the facts. We need to share the facts. We need to learn not to, call people, Ebola this or Ebola that or, Ebola country, stuff like that. And we need to, when we hear people saying negative things or stuff that is considered stigma, then we need to speak up. We should not let it go, okay? So whether it's, in the media, whether it's at work, yeah, whether you're at a party, I don't care where you are. If someone says something that is offensive, you feel that you're stigmatized, because you're from a place with Ebola, you need to speak up. You need to keep speaking up. I don't care. Use social media to fight it. Do whatever you need, talk to people, and that's why, another reason we have the SLCNJ rep here. As a community, we can do something about it, and we want to hear about it, and we want to be able to fight this. And these are all websites for those who do like to go online. The CDC has tons of information. They have Ebola information in Creole, Mandingo, Mende, Fula, all, they have audio that you can listen to. The state has a lot of information and handouts, and they all have links to the CDC. Their YouTube, even President Obama created a YouTube video to address the stigma, of Ebola. All these are on the website. So instead of people just finding, funny things on the internet to, send to WhatsApp, share, things that are going to, impact people's lives and really help with this problem. And I just wanted to dedicate this, just as Andrew said, I know a lot of the medical personnel back at home. 6 doctors now have died from Ebola, 6 Sierra Leonean doctors have died. So far, 588 West African health workers. And when we say health workers here, they're counting only doctors and nurses. They're not counting the lab techs. They're not counting the burial teams, the cleaners, okay? 337 of those have died. In Sierra Leone alone, about 137 health doctors and nurses. 6 of them are doctors. The rest of them are nurses that have died from Ebola. This is serious. The most recent, Dr. Salia, I knew most of these people personally, so this is really a big deal. And we really need to take this seriously. We don't want their sacrifices to be in vain. We don't have a lot of doctors and nurses.
Thank you so very, very much, Dr. Suarez. We can all see there is a lot of things that we need to actually talk about. There's a lot of things we need to question. There's a lot of challenges. There's just a lot of things, a lot of passion, a lot of compassion, and just in general, a lot of things that just singly by ourselves we cannot do, but as a community we can really impact on. So the parts I really like to stress is really the stigma. And, you know, we joke about it. We should not hesitate to say something when somebody says something really offensive. It's not the proper thing to say, especially at work. We can have people who are at work. There is no need to be embarrassed that you're from Sierra Leone. At Robert Wood, we have 8,000 employees. I think I'm the face of Ebola over there because I was at the department directors where every director from the CEO and that, I was giving a talk on something. The first thing I said was, I am from Sierra Leone. So that's the very first thing. So at least during that moment after that, any director who wants to say something negative would think twice, you know, so they know that that happens. And for Rutgers, of course, Dr. Suarez is the face of, you know, representing Sierra Leone at Rutgers. So this is what we have to do. There is nothing to be embarrassed about. Ebola is not a person. You know, it's just a disease that unfortunately happened in our country, and, you know, we have a very, very rudimentary healthcare system. So it caught us at a level where, you know, we were really not prepared. And just before I take questions, you know, when I was interviewed once by NJTV, and they asked me, what do I think about Ebola spreading in the United States? And my comment was, I don't think it's going to take a hold in the United States, which is probably true. My reasoning was because in the United States, we're used to using, you know, the PPEs. We know how to wear the isolation gowns and stuff like that. But guess what? Even the most advanced country, the United States, where everybody's used to using PPEs, we're still able to get transmission in Texas, right? It went through. So just imagine in Sierra Leone. Hence, you can understand why we've lost so many of our medical practitioners, you know. Hence, a reason why we should continue to support, you know, the medical professionals there, just our own people over there. There is a lot, and this is what we talk about almost every day, is the misconceptions and the, you know, the ideas about Ebola, where Ebola came from, and, you know, what's this person doing, what's that person doing. Our role, my role is not to defend any of that or to argue with any of that. But if you make a statement that will let somebody not take Ebola seriously and they catch Ebola somehow, you're responsible for that. If somebody tells me that Ebola doesn't exist, and then I concur that and say, oh yeah, no, Ebola is just from, you know, from one country in South Africa that's doing X, Y, Z, and you do not take Ebola seriously and go catch Ebola, I am responsible for that. So no matter what your ideas are from where Ebola is, no matter what school of thought or what you subscribe to about conspiracy theory, it's irrelevant. It's there, our people are dying. It doesn't matter where it came from. So we just have to think about that when we concur, when we post something on Facebook, when we post something on the social media, we have to be conscious of that. Because we take it, you know, we take it lightly. Somebody posts and says, oh, this is the whatever government doing a bioterrorism test. That's irrelevant. It's in the country, our people are dying. How do we solve that? That is the point. So I just want us to be really, really be cognizant of that and I'll start taking questions. We have
For the state.
oh, for this? Okay. We can just, if we have the answer, it's fine. Yes, just go ahead.
In the event a family member have a visitor from Africa who tested positive, we know that the whole family is going to be quarantined, and probably eventually the apartment or house is going to be, everything in it is going to be destroyed. Is there any compensation package by the state in place?
So there is no question to that in terms of compensation. To just probably, I hate to speculate, but I don't think there will be compensation, and I don't think they actually destroy, they disinfect. What do we do?
Well, maybe the doctor was saying not to touch, to call the proper authorities, and then go from there.
So
What's going to happen with the cleaning and sanitizing?
yeah, I know they will bring a crew to clean and disinfect the place. There's a chance, obviously, that things might get destroyed in the process. But compensation for that, I doubt. I cannot answer for sure, but I'll definitely forward it to the state people if they haven't done that yet in New Jersey, so I don't know. They might not have an answer yet.
One in Texas, they have to depend on donations.
It's probably going to be the same thing, because what I can tell you is, the health departments don't have a whole lot of money for the programs that they have. So try to compensate individuals for property in this kind of thing, it's going to be hard. And that's another reason why, as communities, we need to be aware of what's going on, because if, God forbid, something like that happens in our community, and the state or the federal government, cannot help, or the areas where they're not going to be able to help, as a community, we may have to rally behind those people.
And the state does have a 1-800 number you can call for questions.
So in case, the question are not answered here, there is an 800 number to the state that we can, that you can forward question. But this is a very important question. Let me just add a little bit on that. This is the reason why, as a community, we have to come together. Okay? When this happened to the Duncan family in Texas, the fiance could not even get an apartment to rent. People will not rent an apartment to her. The state somehow had to look and find a way of renting a place for her. There was no place for her to live. This can happen. So, we keep stressing this, and it looked far-fetched, but my mom is here now, but my uncle might be coming from Sierra Leone, who has a green card, who's a citizen in the United States. Come to visit. And, whatever you go through, and God forbid, one member of our community is diagnosed with Ebola. I mean, we have the whole media to deal with. We have the whole stigma to deal with. I mean, it's really going to affect us seriously. So it's something we really, really have to strongly think about, how we can support one another as a community. It's very, very important. Know when it actually happens. One second. Yes. Indol, take the mic to Susan.
Good afternoon. Susan Bona here. My question is to Dr. Soare and Mr. Jawar. From the opening statement, you talked about being in touch with all the doctors in Sierra Leone from the onset of this mayhem. I want to ask you, what have you guys been doing, in order to educate our people back home so that we can reduce the number of deaths, especially the doctors? Because I'm bothered by this. I get confused. This is my question every day. Why are doctors dying? I mean, the education about Ebola has started since when? February, March? And up to date, just about 2 weeks ago, we lost another doctor. When is this going to stop? What are you guys doing? What kind of help are you guys really offering to them? Because maybe something is lacking back there. Then secondly, the other question I had is, I heard about nano silver. I think it's a supplement that's been given to people, because I called back home, I asked them, okay, Are you guys implementing this? Are you guys doing this? Because I heard about, the last time when some people that got cured here from Ebola, the doctor, Dr. I forgot his name. He was offering to give his blood to others so that they can help in curing the other people that got the disease. So I asked, I called Sierra Leone to find out if they were doing the same thing, because really we've had a lot of people that have survived the Ebola, and especially Freetown, Sierra Leone, even more than Guinea and Liberia. So I was told about nanosilver. It's a supplement, I believe, that's helping to boost the immune system of people that have been affected. Do you know anything about that?
I can take a stab at some of them. So I'll start with the treatment questions first. So I have heard about the nanosilver and the claims of nanosilver potentially being a treatment. I don't know a whole lot about how it works. And as far as I know, with the plans for experimental treatment right now, it's not listed on one of the ones that they're going to be trying. What's going on right now is the WHO is coordinating all of the experimental treatment between the WHO, the CDC, Doctors Without Borders, and all the other medical groups that are working there. But with the leadership of WHO, they're coordinating all the experimental treatments that will be used. Because, it's something that I didn't go into in this talk. I think it's a little bit beyond this forum. But there's a lot of, when you're talking about trying treatments that haven't been proven, just because one or two people got better doesn't mean that it's a cure. There's a lot of issues to make sure that it's done right and people are not turned into guinea pigs and we don't cause more problems than we're trying to solve. So I have heard of nanosilver. I've heard of nanosilver for a while. As far as I know, it's not on the list of experimental treatment. So what happens is if any scientist, drug company, anyone that has an idea or has a potential treatment or something that they think is a potential cure, they send that information to the CDC with the data to support why they think this drug or this vaccine will work. The CDC reviews it. If they think it's credible, if they think it's been tested enough to give it credibility that it might work, then they will put it on the list. So that's how that's been worked. So when it comes, because nanosilver is not exactly a drug, I don't know, how that would fit in with the protocol that the WHO, has right now. What you're talking about, the transfusion, it's called convalescent serum therapy. It has been used in previous outbreaks. The results have been mixed, but overall tending towards positive. It is part of the planned treatment. I know right now in Sierra Leone, they are doing collections to start that. It took a while, again, because when you're in a situation where you don't have a good healthcare system and you never had a system in place for trying and organizing new things, it's really hard to do these things. So, and people cannot just come from another country. We're all worried about conspiracy theories, and people are worried about that. The international team are also worried about that because they don't want to be perceived as coming to experiment on a group of Africans. So even if someone it has to go through the proper channels, and the people from that country and the WHO and all the parties need to be comfortable with it and agree, because they don't want to have claims later on in lawsuits that say, oh, you guys came in and poisoned our people. So because of all those protocols, it takes a while for things to really get going. But in the next few months, a lot of things are going to be in place as far as treatments, and convalescent serum is definitely one of them. 2 vaccines, and I think about 3 or 5 drugs. I forgot the count now, that are probably going to be used, that have shown that they have some evidence that they work. And the other question is about what are we doing about the doctors and nurses that are dying. That is something that weighs heavily on my heart, and my husband can tell you that every time another person dies, my day just, I'm like semi-depressed now all the time. But the information, the reason the healthcare workers are dying is not because of a lack of Ebola information. It's because of a lack of resources. Other than Dr. Khan, who actually was taking care of Ebola patients and, in a treatment center, and he was the first doctor that died, all of the other doctors were not working with Ebola patients. So they're working in their regular clinics, their regular hospitals, trying to take care of everyone else so they don't die from their diabetes and malaria and things like that. And someone comes in who may have Ebola, may not have Ebola. They don't have enough equipment, they don't have enough PPE, they don't have enough trained staff to do proper triage, and then they get exposed to someone who turns out to have had Ebola. And that's what's been happening. That's what's been happening with the nurses. There's still a big problem with triaging in our hospitals that are not Ebola treatment units. The Ebola treatment units are not having doctors and nurses dying, it's outside of that area. Outside of that area, it's run by, whoever owns that hospital, or if it's a government hospital, the government staff. There's still a lot of problem here. When people donate money, they donate into, organizations, and it goes to that organization center that they're working on. It's not going to, Bow Government Hospital, it's not going to Connaught Hospital, it's not going to PCMH. Those doctors that are working there, they're at risk because they're not getting good support. They're not getting enough resources. That's still a problem. I'm an advisor for the town. We have a task force that was actually based in DC of health providers, and that's one of the issues that we're trying to deal with. One way to deal with that issue is get more people there, get more doctors, get more nurses. That's really hard to do. We've had a lot of challenges even trying to recruit doctors and nurses from here. We haven't given up. We're still trying to do that. But that's one way to deal with that problem. Another way is to make sure that all those hospitals are adequately staffed and they have adequate resources, and they're able to test. There's still not enough testing facilities. It takes a while to get people tested. If we can test people right when they come in the door, then the doctor can know for sure whether I'm going to leave this person alone or not. But if a pregnant woman comes in and they're bleeding and they're about to die, as a doctor, they got to make a decision. Am I going to take a chance that this is just a pregnancy complication? What if it's Ebola? And for a lot of us, we cannot just watch a person die. We were trained to try to save people's lives. And they go and they do what they can with what they have. And this is what happens. So it's on all of us to help make sure that they have what they need to save their lives.
So in addition to what Dr. Suarez said, Susan, another thing we actually did is be in constant communication with, the healthcare providers in Sierra Leone. Unfortunately, there's a limit to what you can do. But just knowing what's going on there is very helpful. We're very familiar with the health center in Kenema, and actually talked to the matron and the deputy matron over there just to see what they have. What's going on. The one thing I've always been informing our colleagues here, or even, people of the community here, we tend to have a knee-jerk reaction in the way we send things back home. We just, we're always in a hurry. Oh, there's Ebola. Let me send gloves. Let me send, masks. Let me send something, without really taking time to see what they actually need over there. I can just give you an example. I spoke to the deputy matron the other day, and this was probably 2 weeks ago. Great, somebody sent some beautiful goggles. You need the whole thing for goggles. But these goggles were not anti-fog goggles. So they put them on, went into the treatment center. In like 2 minutes, it's foggy. So you can't even see. So it's even more dangerous than wearing but just knowing what the right, not just the PPE, but the proper equipment that we send over here, it really, really means a lot. So communicating with them, and then doing certain things that we actually do here and do it the right way actually significantly helps. Yes. Indo. Mr. Barry. Yes. Oh, let us ask. Okay.
No, I was just reading the other day that it cost $220,000 to evacuate Dr. Salia from Sierra Leone to here. And it's a Methodist church that is raising funds to defray that cost. My question is, if suppose a relative visits us and we are the co-signer for invitation, are we responsible for their medical treatments while they're here?
So I actually anticipated that question and asked the state that question, and they sent me an email response. So in this country, there are laws called EMTALA laws, and there are hospital laws where if a person is sick and needs emergent medical care, the hospital cannot turn them away and whatnot. So the hospital has to treat them. So that person can go to a hospital, they will get treated. You may get a bill, or they will try to send them a bill if you can pay it, but they will get the treatment. No one is going to hold you personally responsible and mess up your credit because they came and they were visiting you. They will send them the bill, the individual person. Well, if it was a child, if it was your child, then you will get a bill. But no one's gonna take you to court or collections or whatever for that. Okay. But that should not, lack of insurance should not keep people from seeking, the care that they need. That's first and foremost.
Okay. So, the guy in the yellow.
Thank you very much. One of the things really, as you were making the presentation, you really asked the question, what can we do? I'm coming from Sierra Leone, to be specific, Tonkolili district. I came in here on the 25th of August. But before I came here, I was doing some education program back at home. When we are giving education, it has to be ongoing. And every Saturday, I make a 1 hour talk on Ebola. I make a 30 minutes presentation, and then 30 minutes Q and A and Q, and that has been helping so much. And my chiefdom happens to host the hydroelectric project, Kalansokoya Chiefdom, and of course, African minerals are there. And to date, it is 100% Ebola free. That tells you education is power. You see. My question here is the case of Duncan. He was flown from Liberia to here, and he had his inmates, his fiancée, and up to the time he died, up to this time, we have not heard anything about the inmates and that they are Ebola free. Yeah. It poses some question to some of us. Really, can you help us? Why up to this time they are Ebola free? And we say it is highly infectious from the second day to the 21st day. And this is something that I have been thinking about. What are the dynamics? Why none of them did not get infected up to this day? And then the nurse that was taking care of him got infected. Thank you.
Let me give that a start, and Dr. Suara will talk about it. Your first question was, what can we do? And just exactly what you did in Tonkolili, which is educating the people, we do just that. When we talk to our people back home, educate them. What is Ebola? And how is it transmitted? How can you prevent it? How can you protect yourself? And so getting to your question about Duncan and the family, as Dr. Suari said, Ebola is not forgiving at all when it is symptomatic, when you have a symptom. If you do not have a symptom, if I am talking to you, you don't have a temperature of, what's the temperature now? 100.4 or 100.3, you don't get it transmitted. It's transmitted by body fluid. You don't get it because you share the same plates with the person. And we've known that since 1976 in the Democratic Republic of Congo, in Kikwit, where we think it probably started spreading. We have people and children. Remember there, the children don't really have direct contact with their parents. They eat in separate areas and stuff like that. They stayed in the same home. The mom and the dad died of Ebola. The kids stayed, no symptom at all. So we've known that. It's easily transmitted when you're symptomatic. For Duncan's case, his fiancée, which I was very happy about that they did not contact the disease to show that it's not easily transmitted, you need direct contact. But the nurses, by that time, he was very, very sick. His viral load was very high. It could be very easily transmitted at a particular time. So any mistake at a particular time, you will contact Ebola. So, but I don't know if you want to add to that.
Yeah, I mean, just to buttress that, you have to think about how we behave when we're back home versus how, people behave when they're here. So back at home, it is not uncommon when we go, you're drinking from a bottle, somebody takes it from you, they drink it. They may or may not even be your child or close relative. We don't think anything about it. And I came to this country and they were like, oh no, even my stepson, would not share, the same bottle with me, right? Because they taught those things. Bathrooms, very, very different, right? In this country, if someone is sweaty, they throw up, I'm not going to touch them. It's kind of like it's icky. We don't do that. Back at home, that sense of, personal space is not necessarily there. And if you have 10 people living in the same room, that becomes a challenge. And people don't think, and this is not to put our people down. It's just the way it is in some part. And it's not every place. Because, I have a lot of relatives back at home. And thank God, so far, none of my, close relatives have had symptoms. But it's how we act and how we behave. It's different back home versus what people, do here. Here, people don't necessarily, they'll think twice before they touch, someone's stool or someone's vomit, even if it's your kid. I take care of, women that have babies, and some of them don't even want to clean their babies, butts. So, back at home, my grandmother would, take her hand and wipe and wipe it on it, and she doesn't think anything about it. Those things, some of those things that we do when we don't pay attention to infection control, those are the things that put us at risk. When we come here, we act differently. When I go home, I would admit, even as a doctor, when I go home, I kind of like get a little bit, slagger, like, oh, I'm an African, this stuff is not going to kill me. Well, Ebola will kill you if you're careless. And so that's part of the reason why, you can see that you really have to have direct contact with their body fluids. I really doubt that Duncan's wife, I don't know, for sure. I really doubt that, that she was cleaning him up and doing things like that. Now, when you're in a hospital, it's a whole different setting. When you're there, you're paid to do that stuff. I used to be a nurse before I was a doctor. There are a lot of things that I've done, for patients that I haven't done for my husband. So, because that's what I was paid to do. And those things are what puts you at risk, when you're in a hospital. If the patient has diarrhea, you're responsible for cleaning them. If they're vomiting, they might be sitting there and they just throw up all over you. So you're really very intimate with them in a way that their spouse may not even be. And that's why in the healthcare setting, it can be a really dangerous thing if you're not properly attired. And that's why, people are wearing those hazmat suits. Okay.
Yeah, sorry, 1 second. There's somebody in the back.
Thank you. I have 2 questions. The first question is, my sister came with her 3 kids, and we're about to enroll them into school, and you were talking about the stigma. Now, is there any place where we can complain in the event that started bullying them, the fellow students? Because after a while, they're going to know these kids came from Africa and Sierra Leone, and they're going to bully them. Is there a place that we as parents can go and complain to avoid it to continue? That's one. Secondly, in the near future, is there any way that they can provide drugs, like when we want to travel, we can take it, like we do for malaria and typhoid? Do you expect that to come down the road?
Those are 2 very good questions. But the first question, I don't know if Mr. Jallo wants to give that a start. If there is if something happens when, students in the school.
Thank you. Actually, I was hoping that someone will ask a question that I will have to answer. So, so yes, I thank you for that. And that gives me an opportunity to do 2 things before I respond to your school-related question. One is to thank all of you, Sierra Leoneans in particular, and all the wonderful friends of Sierra Leone for being here today. It's a good opportunity for us. This is one of several meetings, diaspora-based meetings that are happening across the country and across the world, and it's important that we do these things. Before I left this morning, my 8-year-old son asked me, we woke up, took him to breakfast, and he said, "You're going to a lot of Ebola meetings. What's going on? Well, what's the benefit? Why are other people not showing up?" And he opened this little fortune cookie that I got him the other day and gave me a note. And I'll read that for you, and I think this will make sense to a lot of us. Man's biggest mistake is to believe that he's working for someone else. What we're doing today is for us. It's not for anyone else but for Sierra Leoneans and the world as a whole. And I say this, and that's the first area. Secondly, I'd like to recognize someone who's here today, and that's the Deputy Government Spokesman for the Republic of Sierra Leone, Mr. Ajibu Jallo. And additionally, there is no bigger threat, and I mentioned this a few weeks ago. We were at Franklin Township. There's no bigger threat that we face today as a nation than Ebola. So whatever we do now is something that we have to continue doing. At the end of Ebola, there will be additional needs that will come, and that's post-Ebola efforts. We currently have no schools in Sierra Leone, and that leads to your question about schools here and education as a whole. Our schools are closed. Once Ebola ends, there will be a need to clean those schools so that our students can return back to school. The roles that we play today, the preparations that we make to support our people back home, to support the government's efforts, to support the international community, so that our kids can return back to school, we really build the bridges that we need to return back to normalcy. So we need to take those things seriously. So whatever we do, keep thinking post-Ebola, what will happen once Ebola ends? That's going to be what us Sierra Leoneans as a whole who happen to be alive today, that's what we will be judged by in the future. And particularly those of us that are in the diaspora, we have a bigger role to play because we are Ebola-free, and we thank God for that. So it's our responsibility to ensure that we help those back home. Regarding your question, and I'm sorry it took so long to get to that question, we had a meeting last night at Franklin Township. I'm not sure if you're in Franklin Township. Okay. And it'll be similar to other systems, other school systems. The couple of areas that you go in, we asked this question yesterday. Actually, I think the Ambassador Plenipotentiary brought that up with the Franklin School District. And the councilman actually is a member of the school board in Franklin Township. And he's bringing those questions up. This is new to all of us. So there are really not processes in place yet. But we can still use the same complaint systems that we currently use. So reach out to your guidance counselor. If you participate in your local school system for any reason whatsoever, which some of us do because we have children in the school system, use those resources to agitate, if you will, to respond to some of the challenges that our children face. And give some of us a call. There's several Sierra Leoneans in this community here in central New Jersey who are parts of a lot of things. I was one time a member of the Chamber of Commerce in Franklin. So Sierra Leonean business people spoke to me about things that they needed resolved. So ask those questions. We're hearing you, and we will look for individuals who have solutions to things of that nature. But it's a serious one. It certainly happened in New York a couple of weeks ago, the Senegalese kids. So it will continue to happen. And it's our responsibility to, again, not only agitate over it, but work with the school systems, because they are willing to help us, and they know that these things will happen. So I thank you for that. I hope that helps a little bit, but let's work as a team to really bring this to a close.
Okay. One quick question.
Yes. My question is actually directly to the Deputy of Spokesman of the Republic of Sierra Leone. What are the preventive measures that they take in regards to waste product? How do they get rid of waste product back home relating to the Ebola victims in effort to contain the disease?
I think so.
Not that I want to avoid the question, but I'm not sure if I have jurisdiction here to speak. I'm here as an observer, but being a deputy government spokesman of the whole country, and this is Ebola, and Ebola is front and center, I think it's a valid question. But let's be specific. Are you talking about just a regular thrash, or are you talking about thrash that has to do with medical? The victims? They're burnt up. Outright burnt up.
Yes.
Okay? They're burnt up. Outright. All right?
You want to add to that, or that's it? No, one second. Yes.
Yeah, I think you were asking about the trash, like their personal effects. Yeah, so what you said. I was wondering whether you were asking about like those stool and like or that stuff. I was like,
okay.
Yeah,
One
so,
second.
and
I'll get to you. I
that's
promise you.
why
1 second.
When we talk about post-Ebola efforts, even some of that is not post-surviving Ebola. People leave and they have to get donations of clothes and things to wear, because whatever you come in with into an Ebola center, you don't leave with anything except what is donated.
Yeah. Based on the question that Mr. Barry asked, it's a very important question about our kids being stigmatized. Yesterday, when we had a press conference, I took the issue up with the councilmen who were present. And just to let you know, he gave us full assurance that he was going to go to the school to handle that. So let us keep working with not only with the township. When you have those problems, let's deal directly with the township, because they have that leverage over the schools. So he gave us that assurance yesterday. So I believe he's going to do something about it. All right. Okay.
Is there a link for people to be able to download this exact same presentation? So that way we can share it to people?
I can make it available.
On Facebook? Yeah.
So we'll take
Doctor, can I answer that? In Middlesex County, also in Somerset County, we do offer an Ebola Basics PowerPoint presentation that we can come out and present to your community or your, affiliate, whoever you're affiliated. We can come out upon request and then provide that for you as well.
Thank you so much. So we are actually pressed for time. We'll take 2 more questions. My wife is standing there. I have to go home, so she'll have the last question. Otherwise, I won't go home. We'll take 1 more question here. Otherwise, you can't go home, right? I can't go home. I have to save that question.
Okay, my question is a 4-fold question, so I hope you guys can. I'll try.
Make it one.
One, I know for Dr. Soare, I think you'll be the best person to clarify the use of hand sanitizers, because that is something that has been very popular from the beginning of Ebola in our country. People thought that using chlorine and any hand sanitizer would work. And I know when I did a presentation last week at Essex County College, I let them know that the use of hand sanitizer is not just any hand sanitizer, because nowadays we all know you can go to any corner store and get a hand sanitizer. So you want to get the right type. I don't know how well you can do to clarify that for us. Also, the fear of stigmatization in our community. I think it would be good if you guys can educate our community that when we have people coming in, we should not have that fear of letting the community know when they start showing symptoms for us to bring them out. Because as we all know, this is one thing that led to Ebola spreading in our country, because people were so afraid to say, I have someone in my home that has the, possibly has this disease, and therefore we kept them at home, and then before you know it, Ebola was everywhere. So if we ourselves are not afraid to bring them out and to keep them at home for at least 21 days before we start showing them to the community, I think that would also help us out. Also, to the New Jersey Department of Health, I think I'll make this the last one because I already forgot the 4th question. I would like to know, this education is geared towards adults. What are we doing to educate the children in the school system? Because that's what my focus is at this moment, is if we can get to these children in the school systems and educate them on the basics of Ebola, I think it would calm their fears, because as we all know, people are always afraid of what they don't know about. Thank you.
Dr. Soare will answer the question about the hand sanitizers.
Actually, I'm gonna, yeah, and John can answer just 2 questions.
Hold on 1 second. Hand sanitizer. guess you can't find it when you need it. You could start, someone could start on like,
yeah.
If I can find it real fast, that's fine to find it.
Just one slide here. Okay, while John is looking for that, Jario wants to make a suggestion.
It's not a question. It's a suggestion. I heard you when you talked about the goggles. Okay, I think you should sit down. I mean, Dr. Swire as well. Make a list of the right things that they need. Because some of us just go and say, oh my God, they need gloves, we'll go buy those gloves in those boxes and send. But if we have a list that we go by, or at least, you help us out with that, I think that would be nice.
Which is really a good question and a good suggestion. We're having different, different groups and different things that they're looking at. And every time I talk to different groups, is to actually let people know that before you send anything, really just do some needs assessment. So if people reach out to us, unfortunately, this was not the particular forum for that. Our purpose here was to really make an awareness. But that's a good thing. There's a lot of different groups. They can use us as resource. We actually initially communicated with, the Ministry of Health in Sierra Leone to get their needs assessment, what do they actually need? And then looked at what we can provide here. So we looked at that, and then, we can share information like that. So a lot of people don't know. We can just base that on what we know. Dr. Swire is very familiar. She's been in contact with Médecins Sans Frontières, Doctor Without Border from the inception. So we know actually what they need. And hopefully if people reach out to us and say, okay, we're planning to send a container of something, then we can probably help, okay, in that particular regard. And you good? Okay.
Yes. Okay. So for the hand washing, which we already discussed, the best thing you can do is washing your hands with soap and water for 20 seconds. If you needed to use the hand sanitizer, it's advised to use the sanitizer that has 60% alcohol.
So at least 60%.
60%. Okay. Now for the presentation for children, yes, currently we do have a Ebola Basics PowerPoint presentation for adults for the community. Currently there isn't anything for children about specifically about Ebola, but there is on the Substance Abuse and Mental Health Services Administration. There is material documents for tips for caregivers, parents, and teachers on talking with children during infectious disease outbreaks.
Where is
so,
the SAMHSA website.
Yeah, SAMHSA. And I guess you can Google in talking with children, and the whole document is tips for caregivers, parents, and teachers during infectious disease outbreaks. And it's kind of like a what you should know, possible reactions. They have preschool children 0 to 5, infants, children 3 to 5. They have tips for all those specific age groups. So that would be your best bet for your question on that.
Yeah. And I think the state has a link or a shorter version of that on the state's website, and the CDC also. They've created, like dealing with the anxiety over Ebola, and the emotional response and the psychological response to that. They have like little handouts for that. That you can use also.
And for more state information would be the State Department of Human Services for that one.
Okay. Well, I'm not here representing the state, but I just want to say that I did offer to Caroline Daniels, who currently heads the Minority Health Affairs, as a representative within the community to see if there was any way we could be of assistance to reach out, that we could make those necessary leads. But you can always direct all your questions. There is an ongoing task force at the Department of Health. And again, I'm not here representing the Department of Health, but I do work for them. Any questions at all, they don't have all the answers. And so because it's our community and we are more intimately involved, it's best that they hear from us as to how best they can meet our needs. So the more questions you send them, the better, because we have to show interest. It should not just be a handful of people. We really shouldn't be, most of us here are American citizens. We vote for a lot of these leaders. We have to have our voices heard. So please do not be intimidated to reach out to any government official at all to ask a question. On that note, my question, it's not actually my questions, I'm asking it on behalf of Mr. Suma, who had to leave early, Jismed Fode Suma. 2 questions. One was, we do know that Ebola is airborne. Currently, we do know that it is airborne. His concern was if you were traveling, say, in a flight, and someone perhaps had Ebola symptoms and sneezed, and as a result of their saliva getting on you, could you contract Ebola? Yes. I think I answered that question, but I do want medical expertise to respond as well. The second question was, because we know very little about the current burial procedures in Sierra Leone, and most of our people depend on well water, is there a possibility that from the burial procedures, something might get into the water which the people drink, and can they be infected from that?
So the question, if someone coughs or sneezes or particles fly out of their mouth and get into someone's eyes, mouth, etc., is that airborne? That's called droplet spread, and that means that droplets are forced out of someone's body while coughing, sneezing, vomiting, etc., and fly through the air, and then they quickly fall out of the air. And airborne means that the virus particles come out in a person's body, breathing, talking, etc., and they hang in the air for a longer period of time and drift along air currents. And that's some examples of like tuberculosis or measles. So with what we're dealing with here with Ebola is it's a droplet spread, not an airborne spread.
Yeah, and so in terms of the gentleman who's worried about his risk, as far as we know, no one has caught Ebola from being on a flight with someone who had Ebola. So that hasn't happened yet, because even though, on flights, when you fly in economy, you're pretty close to people, most people will be too polite to sneeze in your face, and you have to have your face up and your mouth open and your eyes wide open for it to land on your mucous membranes. It's a little bit hard to have that happen, and and they will be pretty sick, at that point to be able to spread it like that. It hasn't happened yet. And it's highly unlikely. And I know, all these flights that, the people that have come back and, later were, tested positive, I know they've done, reached out to people on the flights just to reassure them. And so far, there haven't been anyone that has tested positive by being on a flight. The other question about water contamination, that's a concern for, for everyone who thinks about the environment. One thing we know for sure, at least what WHO and everyone has put out, as far as they don't believe there's a risk of water contamination. The major reasons, number one, they are asking to do deep burial for the countries that are doing burial for Ebola patients. But because the virus doesn't survive long outside of a living person, it doesn't stay in the soil. So viruses, one of the differences between a virus and a bacteria, some bacteria can live even outside of a live person. They can survive. They have the ability to survive in the soil or someplace else for a while. Most viruses don't. Once they're out of a living cell, if they're not able to get into another living thing within a few hours or a few days, for some viruses, they die. So because of that, once a person dies and they're buried and they're in the soil and that person, there's no living cells anymore, the virus dies. And it doesn't go to sleep and then wakes up when, it gets into somebody else. So that's why the reason we don't believe that there will be any, water contamination. If we're dealing with a bacteria, with some different bacteria, that might be more of a concern. But not in this case. Okay.
Okay. And as I said, we're pressed for time, but I would actually like to introduce a few people here. We have Dr. Peter, how do you pronounce your last name? Guanacha. Okay. He's a medical anthropologist, and he actually studies how diseases or problems like this affect communities. So he's here. We welcome him here. And he works with Dr. Jennifer Warren. Okay. And your title again, Jen? Community health communication, and community engaged. expert.
I study the way in which health is acted out in communities.
Wonderful. So again, tied with Rutgers University, so they're here with us. Thank you so much for coming in today. Okay, and you know, we actually look forward to working with you guys. If this community can help in any way, if you can do a research on how this affects our community, we'll be glad to work with you. I'm sure this community will be happy too. And of course, we introduced Mr. Ajibu Jallo earlier with a question, so I don't know if he has any comment, anything to say since he's a government spokesperson. By the way, Ajibu, I have to limit him to 1 minute because Ajibu, he's my in-law, so I know. So, Mr. Ajibu.
I call him my dinner. In 1 minute it will be. Ladies and gentlemen, folks, I say good evening to all of you. And I want to thank you for the efforts you're putting in. I bring you greetings from the President of the Republic of Sierra Leone, who said Ebola in Sierra Leone is Ebola everywhere. Okay, so the steps that you are taking now becomes very important in making sure you prevent Ebola from coming around us here in the United States. But I want to go beyond that. I want to go beyond the curative aspect of treating Ebola. We want to focus on preventing Ebola. And if we want to prevent Ebola, we need to get down to the ground over there and stop the transmission. That's where we want to be. We want to stop the transmission. We need the labs, we need the treatment centers, but we don't want to use it. If we can stop the transmission, if I take a gun and I try to shoot you, I'm not going to miss you, I'll kill you. But Ebola, you have to go contact Ebola. And the biggest problem we have is being able to tell people, to advocate to people, to emphasize to people, to stop engaging in the activities that we promote Ebola, promote the transmission of Ebola. And that is difficult. That is extremely difficult. And that is where you come in. I'll call it the hardware and the software approach. The hardware would include the information you're getting here. The software is what you can do to talk to them, what you can do to tell your people, to stop the traditional practices. The issue of washing bodies. I remember when I lived here, I was one of the persons that was washing bodies, and I'm saying to myself, what the hell was that all about? Makes no sense. Our president is on a crusade now every weekend, going from district to district, speaking to community heads, speaking to chiefs, and telling them that you must talk to your subjects. You must make sure the numbers go down. Speak to them. Tell them to stop engaging in these practices. If not, I'll take your staff away from you. That is our biggest problem. I'm expecting you, Sierra Leoneans here, to communicate with your folks down there and say, Ebola is real. We've heard the presentation. Everything they've talked about here is true. Everything they've talked about is the fact. It seems they've done their research. It seems to have direct communication with what's happening in Sierra Leone. We need to finish Ebola quickly. We need to finish Ebola fast. We're expecting to start counting the non-infected case by the end of December. Before now, the international community's intervention was very sluggish, but they're there now. We didn't have any treatment centers. We didn't have any olden centers. The capacity for lab work was minuscule. So as such, the sick we kept at home. And when you keep the sick at home, you run the risk of spreading the disease. When you don't have labs that can give you quick enough results, then you're keeping the body at home till such time when you can establish that whether or not this person is Ebola or non-Ebola. And that is why you had bodies sitting home for 3 days and 4 days. But now the international community have stepped up their game. The British are there. The Americans, however, have done quite well in giving us good advice, but they need to put boots on the ground. They need to put boots on the ground. Fixing Ebola cannot be a piecemeal fashion. It's got to be done unprecedentedly. It's got to be done on one bang. We need 1,500 beds to be able to take care of Ebola. We need to add our capacity with regards to laboratories. Once we have that, Ebola is another, just like malaria. If you have Ebola, you go take care of your business. What is important is that we tell our people that the minute you start feeling signs and symptoms of Ebola, go seek medical help right away. If you run to the hospital quickly enough, you will be one of the 1,183 people that have survived Ebola. Granted, Ebola does not have a cure, but they can boost your immune system, as we've heard. They can give you supportive treatment. They can replace your body fluid to the extent where your antibodies will be able to overcome the Ebola virus. The economic impact is adverse, my friends. By December, we'll be $90 million in the hole in terms of tax revenue, which means that my salary might not be paid come December. I can take care of myself. But think about those that are downtrodden. I can take care of myself. I'm good. But think about those that are downtrodden. Domestic prices are skyrocketing. Foreign exchange, which was $435,000 to $100, is now $510. Mining companies have either closed down or scaled down their operations. Agriculture is flat. Tourism is flat. Nothing is happening. All the funds are dedicated to the fight against Ebola. My friends, my brothers and sisters, it is challenging. There's no two ways to say it. It is challenging. It is difficult. You have to do what you can do to help out. Whether it's by advising, whether it's by talking to your people over there, whether it's by putting a container together and bringing in PPEs and bringing in paraphernalias or giving them medication, so be it, but just do something. Ebola is no respecter of color, creed, race, or political party. I don't give a damn if you're APC, double PPC, SLPP, it means nothing. When Ebola comes, you're gone. Ebola kills you. I'm not sure you've seen an Ebola patient. No, you haven't. You haven't seen an Ebola patient. It gets into your body, you get headache, your temperature goes skyrocket, you're down, you're compromised, you're down and out. When you see that, that's when you know it's not easy. When you die from Ebola, you're really dying. That's hell there. Forget about hell. That's hell. So you need to see Sierra Leoneans, Liberians, and Guineans dying from Ebola for you to take this seriously. With those few words, I want to thank you all for listening. Please stay focused. Let's think Sierra Leone, think Guinea, think Liberia. This is not the time to go out partying. You should be ashamed of yourself if you're dancing around and you're partying when your country is in trouble. Folks, let's finish Ebola quickly. We need the international intervention. We can finish Ebola with 10,000 deaths, but it's better off to finish Ebola now with only 2,000 deaths. I thank you all very much. Thank you, sir.
Thank you very much. Thank you so much, Mr. Jallow. As I said, I gave him a minute, and of course, he won't speak for a minute. So we're almost done. I once again want to thank everybody and to remind everybody there's food in the back. People can take food home, okay? And just to remember that Ebola is affecting us now, but just remember the cultural norms that we've practiced for thousands of years. It's gone. We don't even shake hands anymore. We don't. So this is really, really devastating. And Mr. Ajibu, I also hope, as a spokesman to the government, for you to also take this message that, you know, we have the country in our mind, but we also just want the government, our government, to start thinking about the future. After Ebola, what next? We can't, and also the international aid is great, but we have to think about what next. What are we doing about the hospitals? We have tents built. What are we doing right now to think about that? When the schools reopen, what are we going to do? These are things that we have. I know it's, you know, the battle is on, but we have to just start thinking about what next. And if there's anything that we can do, we will do. Thank you so much. Thank you all for coming.